Welcome to the demo video for our GlucoRx lancing device. Here we will demonstrate how to use the GlucoRx lancing device for alternative site testing. Alternative site testing provides you with the option to obtain a blood sample from your palm, forearm or upper arm instead of your fingertips. Please discuss alternative site testing with your healthcare professional prior to choosing this method, as only some blood glucose meters facilitate this option, such as the GlucoRx Nexus, the GlucoRx Q meter and the GlucoRx Vivid meter. Place your thumb and finger on the indents of the cap to grip the lancing device. With the other hand, twist the base in the direction indicated by the arrows on the cap. The cap will become loose and easily lift off to reveal the inner lancet holder. Insert a new lancet into the lancet holder. Be sure it is fully seated and inserted straight. Next, remove the protective disc by using a twist and pull motion to expose the lancet. Be careful not to bend the lancet during this process. Select the clear lancing device cap packaged inside your GlucoRx meter box. This clear cap is only used for alternative site testing. It has a wider aperture at the end and no depth adjuster. Align the cap with the arrow on the base of the lancing device and click into place. Pull the loading control back until you hear a click and the trigger button turns orange. This indicates that the lancing device is now ready to use. Select your alternative site. This can be your palm, forearm or upper arm. Avoid lancing areas with obvious veins to prevent any excess bleeding. Hold your lancing device firmly against the puncture site, then firmly press the orange trigger button. Wipe away the first blood droplet with a clean tissue or cotton wool. Gently squeeze around the puncture site to obtain enough purer blood from underneath to complete the test. Be careful not to smear the blood sample. Continue your blood glucose test as normal. We strongly recommend that you only do alternative site testing at the following intervals: in a pre-meal or fasting state, more than 2 hours since your last meal, 2 hours or more after taking insulin, or 2 hours or more after exercise. Do not use alternative site testing if you think your blood glucose is low, you are unaware you have hypoglycemia, your alternative site testing results do not match the way that you feel, you are testing for hyperglycemia, or your routine glucose results are often fluctuating. Please do not hesitate to contact our dedicated customer care team or your local GlucoRx representative. Our free phone number is 0800 007 5892 or email info@glucorx.co.uk.